Hello, it's Rosalind Henschel. I'm here today with Helen Harrison of Granta Dental in Cambridge, and we're going to be talking about how to find a family dentist. So, hello, Helen. Thank you for being here today.
Hello, thank you for inviting me.
No problem. Lovely to hear from you. Um, the first question that I've got for you is that there are hundreds of people every month who are looking for a new dentist, and a lot of those will be within your area in Cambridge. What are the top three pieces of advice that you would give to anyone who is maybe looking for a new dentist?
Well, the issue with looking for a dentist is that you need to really remember that it's important to choose, because not all dentists are the same. We are all interested in looking after your teeth and looking after your general health, but we all will go about it in slightly different ways, and every individual needs to find the right person to do that. It's probably at least or more important than your choice of hairdresser, because the problem is that your teeth won't grow out. So if you make a choice that doesn't suit you, it's a bit more serious. So you need to look very carefully at what sort of information that a practice will actually offer you, so that you can actually find out whether it's going to work for you. You need to work out what sort of level of service they can give you. So there's cost, but also there's how much time they will spend with you, what a checkup will involve, and what sort of range of services they're actually able to offer. Not all practices can offer everything that you might require, and actually modern dentistry has expanded, and there's lots of things available now that I think people are not generally terribly aware of how good it can be, or what a big impact it can have on general health. So we're very used to the idea of going to regularly to get a checkup with the dentist, and actually the dentist looking thoroughly at the mouth and the face as well, and just meeting you and building rapport can actually help you with a lot of aspects of general health and your well-being that you wouldn't necessarily get if you didn't turn up and have that checkup. So it's more than the teeth. It's not just about the teeth looking nice or even feeling nice. It's actually going to affect your health and well-being very, very critically. So we also need to worry about accessibility, because some people find it difficult to get into the buildings, and so what the building is like, what the practice is like, whether there's disabled access, whether we can actually look after Granny as well as looking after the youngest children, whether the environment is really nice, you know, a spacious, clean, attractive environment that's fun to be in and pleasant to be in, so that children can feel relaxed and we don't build up nasty fears and other problems. So all of those things, you just need to look at them, at how you're going to approach that practice and whether it feels like it works for you.
Great. Okay. Well, there's lots of things there for people to consider, and not a decision to be taken lightly, but if it's the right decision, then it should be something that isn't a stressful thing for people to choose. Okay. So maybe you could tell us a bit more about your own experience in dentistry and how your practice is maybe slightly different to some of the other practices out there. So if anyone is thinking of coming to visit you, they might know what to expect.
Okay, we've been established in the Newnham area of Cambridge for 25 years. I started practicing on my own with my staff, and we've just gradually built up and gradually extended the areas of expertise that we can offer. But mostly, we've wanted to expand the whole experience, so that it's a pleasant experience, that we take time and we build rapport with our patients, so that it's a regular relationship. People talk about my dentist, so we want to live up to that and make sure that we are a go-to place, so that we can deal with the things that are needed to be done in a non-frightening, non-threatening way, and but at the same time be able to offer the range of services. And so what we've gradually done is we've built up our partnerships with other people, and we also include osteopaths and physiotherapists on our team, and our dental nurses and hygienists all work with patients so that we can prevent problems and look at actions that can be taken to minimize the amount of dentistry we do, because nobody wants to have their teeth drilled. And actually, we don't really want to drill people's teeth. What we want to do is we want them to have lovely, lovely smiles. We've also created an environment here with a lovely building you can see behind me. I've got a lovely big room where there's space for children to express themselves and to talk to us. Our waiting room's got a piano in it, and people play us the piano. They come along and relax, lots of books and up-to-date magazines and newspapers. So if you do turn up a little bit early, or we're running a little bit behind, at least you can relax and make it an overall experience, rather than just feeling that you're lining up to come in and have a quick check and go away again.
Wow, I've certainly never heard of a dentist with a piano in the waiting room. That's something quite different. So with that in mind, and all the different things that your practice offers, if someone is maybe watching this video today and is thinking about giving you a call and coming along for the first time, what is the process that they would go through, or what's the kind of experience that they would have as a first-time patient?
Okay, well, first off, if you pick up the telephone, you'll speak to Claire or one of her team on reception, and they will be able to give you plenty of information, and they'll ask you a few questions just to get to know exactly what it is you want. So we offer at entry level two sort of levels of service, really. One is, if you've got a problem today, then we will try and fix it. We'll do a quick appointment, which is a fixed price, that you know exactly what you're going to get when you arrive, and we will do our best to fix, a broken tooth, a lost crown. If you're in pain, we'll do our best to fix that. And you can book that appointment over the telephone immediately and come along. If it's out of hours, we also offer an emergency service. So if you ring our practice number, you will always get through, even at weekends, to a dentist, even if it's just to give you a little bit of advice about what's happening. So that's our first phase. If, on the other hand, what you want to do is to sort of set up some more longer-term care, and that's what we would recommend, you need a little bit longer, because we want to actually take that time to gather the information and find out about you. Because if we don't know about you, then we can't possibly work out whether what we've got to offer is going to suit you, or what sort of things we can advise you about. We can't give you advice if we don't know you. So we always arrange an appointment which is about 40 minutes long as a first appointment, when you would meet one of the dentists, and we gather some information, we talk to you, we talk about your wishes, your expectations, what you'd like to have us do. And then from there we can collect anything further. We charge for that 40-minute appointment, and then for any investigations that we might need to do. And out of that, we can put together a plan in conjunction with you as to whether you need regular checkups or whether you need a whole lot of treatment, and what you want to do going from there. And that is all carried out not necessarily in a dental chair. So we don't plonk you straight into a dental chair and shine the light on you and then ask you questions or tell you off, because that we've discovered is something that people really, really worry about, being told off for not looking after themselves or not cleaning their teeth properly. But actually it may be that you just haven't had the information before. So we try to make the environment really nice so that you're in a position to gather the information and find out what you can do yourself as well to minimize what we might need to do.
Great. Okay, so there's treatment plans for the whole family. And anyone who's watching today, whether it's might be for a quick emergency appointment, as Helen said, or a longer term treatment plan, then please pick up the phone and give Helen and her team a call. The number is on the screen. Helen, thank you so much for coming on today and for answering the questions. Is there anything final that you'd like to add for everyone before we go?
Thank you. Yes, I would. I'd like people to remember that dentists are people too, and we really care about the people we're looking after. It's not, the teeth come second. The teeth are just a wonderful way, a privilege for us to be able to look after people and engage with families. So come along and join. It's always a pleasure to see people.
Wonderful. Well, thank you so much. And on that note, we'll leave you to go back to your busy day. Thank you very much, Helen. Bye.
Bye-bye.